boy's vision is just a little blurry, but the doctor thinks he's about to die. He deliberately hands the boy his cane. Even though the cane is right in front of him, the boy struggles to grab it. This confirms House's suspicion. The boy has a disease that has only appeared 200 times in the world, lipid granulomatosis. He immediately orders a colonoscopy for the boy. Everyone thinks he's crazy, making such a serious diagnosis, based only on blurred vision, and the test results show the boy does not have lipid granulomatosis. But then he makes an even crazier decision. He tells his subordinates to do a kidney biopsy on the boy. His subordinate can't take it anymore and refuses on the spot. Doing such a dangerous test, with absolutely no evidence, is no different from murder. But House says nothing. Instead, he goes to his office and opens a long unopened safe. He pulls out a medical record from the very back. Turns out 12 years ago House had a patient, an old man with the same symptoms as the boy. The old man experienced 7 symptoms in one day and then died. House never even found the cause of death. Years of reflection made him think it was lipid granulomatosis, but the boy's test just ruled that out. If the boy and the old man have the same disease, then according to the old man's progression, the boy should now be at the 3rd symptom, kidney failure. To Jones's surprise, the boy's urine has indeed turned brown, a clear sign of kidney failure. But what disease could cause this series of symptoms? After discussion, his subordinates agree it's most likely lymphoma. However, a CT scan of the boy shows there is no lymphoma in his body, and according to the old man's medical record, the next symptom is liver failure. House decides to give the boy liver protective medicine in advance. This will at least buy the doctor some time to diagnose. Although his liver is temporarily saved, the boy develops a new problem. He starts having trouble breathing. His condition deteriorates so quickly the doctors barely have time to react. He can no longer breathe at all, meaning his lungs are rapidly failing. The doctors can only intubate him immediately to save his life. What's more terrifying is that lung failure was the last symptom before the old man died. That means if they don't find the cause and treat it within 2 hours, the boy will die. Even though it's 3 in the morning, House has to urgently call experts from all fields to the hospital for a consultation. They all agree that Kawasaki disease is the most likely culprit. This disease erodes the lining of blood vessels, preventing blood from properly reaching the body's organs. Perhaps this is why the boy's organs are failing one after another. But an ultrasound of the boy's heart shows no blood clots, meaning the boy does not have Kawasaki disease. Surprisingly, they find a small lump in the boy's right atrium. This is a symptom the old man never had, meaning the young boy is more resilient than the old man. Now all they need to do is a biopsy of the boy's heart to find the cause, but the boy is too weak. Even though House is extremely careful, something goes wrong. He has just taken the sample but hasn't pulled it out yet. The life monitor starts beeping rapidly. The boy's heart suddenly stops. The doctors perform CPR on him for 10 minutes, but as soon as they pull him back from the brink of death, House immediately starts to take the sample again. Jones calls him a madman. After all, the slightest mistake now could kill the boy on the spot, but all he gets is a furious scolding from House, who tells him to get lost. Fortunately, House successfully removes a small piece of the sample, but before he can celebrate, he realizes there's a serious problem. They have come up with 7 possible diseases, but the sample is only big enough for 3 tests. 3 out of 7. After discussion, they decide to test for the most likely, sarcoidosis and histiocytosis, but the biopsy results show it's neither of those. Now there's only 1 sample left, but there are still 5 possible diseases. 1 out of 5. If they choose wrong, the boy will be left to die. Unsure of what to do, House goes to the rooftop to think. Is the tragedy from 12 years ago going to repeat itself? To make matters worse, Wilson comes to brag to him, saying he just won big at the poker table by cheating. Unexpectedly, that's what gives House an idea. He immediately tells his subordinate to use the last sample to test for lipid granulomatosis. His subordinates think he's lost his mind, because lipid granulomatosis was already ruled out by the initial colon biopsy. It's not even among the remaining 5 possible diseases, but House insists on his idea. He believes that at the time of the colon biopsy, the disease hadn't spread to the intestines yet. That's why the test was negative. Although his subordinates are reluctant, under House's insistence, they begin the biopsy test for granulomatosis. A brilliant red color appears. CD68 cells are positive. It's lipid granulomatosis. House was right. The regret from 12 years ago is finally resolved. In the end, after targeted treatment, the boy makes a full recovery.